Welcome to the final show of World Health Social Good. I'm Christy Fogg, the Director of Communications at the World Health Organization. And we're still down at the UN Palais in Geneva, Switzerland for the 68th World Health Assembly. Now, even though the show is going to end today, the World Health Assembly continues through the weekend and into early next week. And they're wrestling some major issues here. Things like how WHO should work with what we call non-state actors. Private sector falls into that, and this is an issue for the member states because they're concerned about the norms and the standards and the guidelines that we do and whether or not working with the private sector would put those at risk. They're also looking at how the organization needs to change in order to respond to outbreaks like Ebola and other emergencies in the future. And they're also talking about how to reduce the health impacts of air pollution. But today in the show, we'll be talking about some issues that are already further through. We'll be talking about immunizations and how we get more people access to vaccines. We'll be talking about antimicrobial resistance, something that you heard about with the German Chancellor's speech on Monday and the opening speech of the Director General. We'll be talking about the earthquake response in Nepal and how the work done here is going to move forward. So it's a lot of ground to cover, so let's get going. Now, if you're looking across public health and trying to determine where is the best place to put some investment, I'd say immunizations would probably have to be one of the places where you should put your money. Immunization has averted an estimated 2 to 3 million deaths every year, and it could be more. It seems like nearly 22 million infants are missed. At the World Health Assembly 3 years ago, the member states approved the Global Vaccine Action Plan to create more equitable access to vaccines. Joining me now to talk about how it is doing is Dr. Seth Berkley, the CEO of Gavi, the Vaccine Alliance, and Dr. Rudy Eggers, the team leader for Immunization Services Strengthening at WHO. If you have any questions for Rudy and Seth as we go, send them in to us on Twitter at hashtag WHA68 and hashtag SocialGood. Rudy, let me start with you. Tell me a little bit about the Global Vaccine Action Plan. What is it and what's it trying to achieve?
Okay, thank you very much. Actually, the whole thing started when the immunization world decided to call the decade from 2011 to 2020 the decade of vaccines, and had the vision articulated that all individuals and all communities would be free from vaccine-preventable diseases within this decade. So a very laudable vision. WHO and the Immunization Partnership came together to then formulate this Global Vaccine Action Plan to reach this vision. The GVAP, Global Vaccine Action Plan, has got the 5 goals, the first one being polio eradication, but then also meeting other elimination targets, reaching routine immunization targets, coverage targets, introducing new vaccines, and exceeding the mortality reduction in the MDG2. So that is where GVAP comes from. It was then endorsed by the World Health Assembly 3 years ago. So the countries basically signed up to these goals and are now reporting on an annual basis on how things are going.
So how's it going so far? What kind of progress is being made?
Well, in fact, at the moment, we have received a report card that is showing it's not going that well. There's an oversight committee that on an annual basis reviews the country feedback. And it's showing that we're actually off track for 4 of the 5 goals. The only one that is on track is really the vaccine introduction. So a little bit concerning. I think everybody realizes that the routine vaccination part is the cornerstone of everything. You can reach many of the other goals by getting the routine immunization targets met. So to some extent, that is the most important part of it. Countries have also articulated a lot around, in the World Health Assembly, a lot about affordable vaccines. Of course, with Gavi around, a lot of the poorer countries are actually getting a lot of support for affordable vaccines, but for the middle income countries and especially also other vaccines that are not supported by Gavi, there are outstanding issues.
All right, Seth, let me come to you for just a minute. Explain how Gavi's work comes in here to complement and support. He touched on just a piece of it a moment ago, but elaborate on that for me.
Thank you, Christy. Let me first start with your original piece, which is vaccines are the most cost-effective intervention. It's also the intervention that touches more children's lives than any other. We've been able to immunize every child on earth for smallpox. We've done it pretty much for polio, and so we know we can do it, and that's important given how cost-effective it is. So Gavi's role in this is we focus on the 73 poorest countries, and obviously this is a subset of the ones that are included in this Global Vaccine Action Plan, but the vast majority of the population and where the biggest problems are. And we're working to try to introduce new vaccines. That was our primary purpose, but to lift up coverage and to strengthen their health and immunization systems. In our new strategy, 16 to 20, we'll still be doing new vaccine introductions, but we're going to change our focus to being much more on coverage and equity, because as Rudy said, that is the critical piece for lifting up vaccination and reaching every child everywhere. We have to think about that even in the elimination targets. Polio elimination, if you've got very low coverage, you can do campaigns, but the population immunity isn't there. So what you need to do is lift up that coverage of the routine so then you can supplement it as necessary. Same thing for measles, and so it goes to a lot of the goals that are part of the Global Vaccine Action Plan.
So get into some of the granularity there for me. How is it that we're working now? The Global Vaccine Action Plan is off rails a little bit. But it's still well within the area that we can bring it back. What is it that we're doing to try to get it back where it needs to be?
So the critical issue there is to try to go ahead and focus on countries that have low coverage. Now, you mentioned 22 million. Those are children that are under-immunized, that they are served, some of them, with, for example, a pentavalent 1 vaccine, but don't receive the 3rd vaccine. There is a much smaller number of children that actually have no access to vaccines at all. But what we need to do then is use good data systems, which is critical, to map where those children are, which countries are important, and then to work with them to go down to the district level, down to the community level, and lift up coverage, reach the children who have never been reached, and as importantly, just make sure the children who are reached go ahead and get their full immunization.
When you see a yellow card come up here, it means we have a question from one of our Twitter viewers. And if you have a question, you can send it to us on Twitter at hashtag WHA68 or hashtag SocialGood. While you have the microphone, I'll just keep this one for you. How can funding for vaccines be increased?
Well, first of all, we are very lucky. Gavi had its replenishment conference earlier this year, hosted by the Chancellor Angela Merkel as part of her G7 presidency. We asked for $7.5 billion to supplement the funding we had to deal with this next strategic period, and we were delighted that countries stepped up, and we actually raised $7.539 million. So there is more finance available than ever before for vaccines, but the critical issue is also how we increase domestic financing for vaccines in countries. And on the Gavi side, we've gone from in the 11 to 15 period, countries putting in close to $500 million. In this new period, 16 to 20, they will be financing $1.2 billion, so a 250% increase. And I think the challenge for us is to continue to focus on building that capacity and finance, because eventually these countries will need to take on the cost of their vaccines.
So people really understand the return on the investment of vaccines.
Absolutely.
Rudy, let me come back to you now. What's happening this week at the World Health Assembly in regards to the immunizations?
So the biggest part is actually the report back on the GEVAP, on the Global Vaccine Action Plan, where the countries actually on an annual basis come back to the Secretariat and report on how things are going to reaching that. And that's basically the discussion. In the plenary discussion, there was a resolution that was proposed that actually talks about the affordability of vaccine. So on your question, how can funding be increased, I think that's the one part of the story, and I think Gavi is supporting that greatly. The domestic funding, as was pointed out, is really important. The other part is the affordability of the vaccine. So as we gear up the production of vaccines, as more and more countries use the vaccine, of course, the economies of scale that kick in. As more manufacturers produce these vaccines, they become more affordable. And that was really what the resolutions was about, to make vaccines affordable for everybody.
Okay, Seth?
If I can just add one point, it was a very interesting meeting that Margaret Chen convened here at the WHA, where she called on ministers of health of countries that were off track, that had low coverage figures, to come together and discuss it. And it was an interesting discussion because, as they said, this is a club that nobody wants to be in, and that each one who is in it wants to be in as short as possible. So advocacy and engaging the political leadership on taking this seriously and moving forward on this is absolutely critical.
Seth, while you have the microphone there, you were just touching on your 16 to 20 strategy. Broaden out for me, if you would, looking ahead into the post-2015 development agenda, where do we need to go with vaccines?
Well, I mean, from my perspective, vaccines are the critical building block of universal health care. As we think about progressive universalism, what you want to do is take out, with the money that you have, the most cost-effective interventions. Now, that's not necessarily normally the way health is budgeted. Often, demand will lead to facilities, for example, in capital cities or tertiary facilities. And by following a plan that looks at the cost-effectiveness, the effects of the intervention, you then can maximally get the best value for money out of your intervention. So as we think of the health side, this is going to be an agenda that is going to look at how do we expand coverage to those who need it. Obviously critical post-Ebola is to think about how we have better data and surveillance systems, which is going to be critical to stopping outbreaks. And obviously it's critical that the IHR, which was a topic of discussion here, are strengthened, the ability for countries to engage in that. That's going to be critical for us to be able to do this going forward.
One last question for you from our Twitter viewers. How can we help countries, now this is talking specifically to cervical cancer, how can we help countries scale up HPV, that's human papillomavirus vaccinations, and that's the virus that causes cervical cancer? You want to take that, Seth, or you want to take that, Rudy?
I can start. It's interesting, HPV vaccine is a very effective vaccine. Cervical cancer is a cancer that is increasing. It's killing right now 275,000 women a year, but by 2020, if that is not, if we don't do something about it, it's actually going to increase. And it actually today is killing about as many or perhaps more women than childbirth. And this is because childbirth deaths are going down.
Is that right?
That is absolutely true, and why it's a priority. So the challenge is that this vaccine is delivered to adolescents and adolescent girls particularly. We don't have a standard and easy-to-use delivery system in most countries. So Gavi has engaged in our countries with demonstration projects initially, working with a district, ideally an urban and rural one, to try to roll the vaccine out and show that we can reach not just the girls in a school or in a health facility, but those that aren't in school because they may be at higher risk. If they show value, then we go ahead and move towards a full rollout on the country. And we expect to be able to vaccinate 30 million girls in up to 40 countries by 2020. Of course, at the end, the goal should be to have every girl and ideally every boy vaccinated against this terrible disease.
Rudy, did you want to add anything to that?
Well, just on the delivery methods, I think that is, as Seth has said, a key point. Up to now, we've been focused on the infant, the below 1 or below 2-year-old, and this actually expands along the line of the Global Vaccine Action Plan, the target groups. And to us, that development of the platform, the immunization platform for HPV, but for all other vaccines that are available, going into adult age, even the elderly, I think is what GVAP also calls us to do, is not to remain in the infant or even child health area, but go beyond.
Terrific. Thank you both for joining us. I'm going to have to let you go and leave it at that, but thank you for coming by.
Thank you very much.
The updates and discussions will continue on the Global Vaccine Action Plan and other efforts to close the gap on immunizations and ensure that the 22 million infants that are not getting the vaccines today can get them. But now we're going to move to another topic that's of hot interest at the World Health Assembly this year, and that is antimicrobial resistance. Now, you heard it at the German Chancellor's opening comments, where she said antimicrobial resistance would be one of the key focuses for the G7 this year. Then you heard it again when the Director General, Dr. Margaret Chan, mentioned it in hers opening speech, talking about the important priority that this was for member states and what a top priority it is for WHO. So really, a lot of people are starting to flag this as a top issue of concern. Joining me now to talk about the problem of antimicrobial resistance and what WHO is doing to try to reduce it is Dr. Keiji Fukuda, the Assistant Director General for Health Security here at WHO. Keiji, thank you for joining us. Can you just start at the very beginning for me? A lot of people aren't quite sure what antimicrobial resistance is. Can you just tell them?
Sure. Christy, so what we're seeing right now is around the world that a lot of the bacteria and different pathogens which infect people are becoming untreatable with the medicines that we have available. They're becoming resistant to the medicines. And because it's happening to so many organisms in so many places around the world, that's what makes it such a key problem.
Mm-hmm. Now, if you have any questions for Keiji while I'm talking to him here, you can send them in on Twitter at hashtag WHA68 and hashtag SocialGood. Now, Keiji, I think I heard you say once, correct me if I'm wrong, antimicrobial resistance is the single greatest infectious disease issue now. Why do you say that?
Well, you know, we're always worried about a lot of different new pathogens coming up and different viruses and new infections, and sometimes we have big outbreaks. But the reason why I call this the single greatest danger from infectious diseases now is because we're talking about a really very broad range of bacteria and viruses, and the consequences of that is that we're not able to treat infections nearly as well as we could in the past, which means that people who are undergoing surgery are going to have a much smaller safety net. It means that people who have diseases like cancer or diabetes, who are a lot more susceptible to infections, are going to have a much smaller safety net. And it means that people who have common infections like urinary tract infections, pneumonias, children, pregnant women, they're going to have many fewer options.
Is there something that people, individuals, can do to try to preserve the medicines that we have as long as possible?
Sure. There are a number of different things. One of the things is for everyone to understand that these organisms naturally develop resistance. You know, that's because they're always trying to escape things which are trying to kill them. And so when people take medicines which are designed to get rid of the infection, a lot of times people don't take them in the right way. They take them for too short a period, they take them for too long, they take them when they don't need them, and this really contributes to these different bacteria being exposed, and it increases how quickly we get resistant viruses and bacteria. And so making sure that you follow the instructions given by your doctors are really important. A second thing is that people often get antibiotics not from doctors. They get them through other means. They may self-treat themselves, they may treat others, and this also can contribute because a lot of times people are using them when they're not needed.
So this week at the World Health Assembly, the member states are considering a global action plan for antimicrobial resistance. Talk about why a global plan is needed for something like this and what the reaction has been to it.
A global plan is needed because we are literally seeing this phenomenon in all parts of the world. There are no places in the world, literally, where you are not beginning to see resistance become quite a big problem. And it's also a multi-sectoral problem, and it's a multi-sectoral plan, which means that antibiotics are used by the health sector, but they're also used in the agriculture sector, and there are a lot of different groups which have important contributions to make. The reception to the plan has been incredibly strong by the member states. They have said this is one of our big concerns. We need this plan, we want to see it, and we want to get on with the work.
How great is the sense of urgency here? I think a lot of times we're used to the medicinal pipeline, having things coming through it. What is the situation with antibiotics and other antimicrobials?
This is a pretty urgent situation. If we take some common situations like gonorrhea, which is a common sexually transmitted disease, in some countries this infection is now untreatable. We have other very common infections like urinary tract infections, which are most often caused by something called gram-negative bacteria. In many instances, we are finding that these infections are becoming either very hard to treat or impossible to treat, and particularly for important groups, groups like pregnant women. And so these issues are happening now. They're not developing issues, but they are here on our doorstep. And so it really adds a tremendous sense of urgency.
So we really are facing a situation where we may be back to a pre-antibiotic era.
Well, we call it more of a post-antibiotic era because, I don't think we'll ever go back to a pre-antibiotic era. But we are entering into a period in which I think it's going to be tough for a while.
Mm-hmm. KG, that's all I have time for with you, but good luck with the Global Action Plan approval. There is so much interest, I think, from the member states, so keep us updated on what's going on there.
Sure, thanks, Christy.
Right. Now, it's not just antibiotics, as KG was mentioning there. All pathogens start to change around the medicines that are trying to control it. So diseases like HIV, TB, malaria all have the same problem. The reason that this action plan focuses strongly on antibiotics is because we've been working with resistance in HIV, TB, and malaria for long periods of time, so that we have strategies going there already. This is the one that's really going to be the raising the tide for all of the antibiotics and other things. And like you said, it is a lot of personal behavior that we need to focus on there. Now, I'm going to switch gears here to something that happened in late April, something that all of us remember quite well. It was the 25th of April when a 7.8 magnitude earthquake struck Nepal near Kathmandu. It wasn't unexpected. We know that that area does sit on a major fault line, but the location was devastating for the people that were living in this very mountainous area. And joining me to talk now about how WHO responded to that disaster is Dr. Poonam Singh, WHO's Regional Director for the Southeast Asia region. Thank you so much for joining us, Poonam. Now, I want to kind of go back to the 25th of April, if you would. I know it was a very difficult day, and you have been going nonstop since that time. What did you do at the very beginning? What did your team do as soon as you heard about this earthquake? How did WHO respond?
Well, it was a Sunday, as you know, when the earthquake struck. And people were not really around at that time. However, they very quickly got together in the operations room, which had been built by WHO and the Ministry of Health together in Nepal. They rang me up when I wanted to talk to the Minister of Health to very quickly assess what the needs of Nepal were, so that our response matched their needs. And he mentioned to me that there was a need for medicines, some equipment. They wanted emergency health kits. They wanted some staff of ours to be there to help them, because they felt at that time, of course, they didn't know of the magnitude of the earthquake. We thought there were about 500 dead. And as days went by, the figures swelled. And now it's over 8,000 that we're talking about, almost 8,600. So I immediately get to work. I think what was very important at that stage of time was that they needed some kind of financial support, because even the national mechanisms don't get to work so quickly. And we in the Southeast Asia region, after the tsunami hit us in 2004, that is the 26th of January 2004, and I remember that day so vividly, because that's Christmas time and everybody's on leave. And that's the day tsunami hit.
Right.
And after that, we had a number of lessons learned workshops just to equip our countries better to deal with disasters, because Southeast Asia is a disaster-prone region. You just name a natural disaster and we have it. We have floods, we have earthquakes, we have mud floods, we have cyclones, we have volcanic eruptions. So as a region, we are exposed to a lot of natural disasters. And in those lessons learned workshops, what came through very prominently was that preparedness was really the key. and we need it. You cannot avoid a natural disaster. If an earthquake is coming, it's coming.
That's right.
You can't avoid it.
That's exactly right. I'm going to get you to hold your microphone a little bit closer because your battery is dying apparently. Now, if you want to ask questions, and you've got to see these pieces of paper coming in here,
okay,
because it means that we have questions coming in from our viewers on Twitter, and this tells me that there is so much interest in this response. So I'm going to try to work my way through them while talking about some of the things that you were just discussing there. One of the things is we have had a country office in Nepal for decades, and we've known, like we said earlier, that it is sitting on a major fault line. What was WHO and the government doing before the earthquake struck to prepare them for something like this, and how well did it work?
We've been preparing them, and we've been working together with the government for almost a decade. There's an emergency response framework that we've been working on. And as I mentioned to you, we had, after the tsunami, identified 12 benchmarks for country preparedness. And these benchmarks relate to legal and policy frameworks, they lead to capacity development, community empowerment. We were working on these benchmarks with Nepal too. And Nepal scored very well on some, almost 100 to 90%, and there are still areas where they need to work more. However, what really helped was that we did stock emergency health kits there, very close to Kathmandu. So as soon as the earthquake struck, we could immediately give them 4 emergency health kits, which take care of 40,000 population for a period of 3 months.
How many people?
40,000.
Wow.
Each kit takes care of 10,000 population for 3 months. So we gave them 4 which were lying there. So we really lost no time in doing that. And within 24 hours, we could release $175,000 from CRF, which is the Southeast Asia Health Relief Emergency Fund.
I want to talk to you about that because one of the questions coming in actually is about that. Here at the World Health Assembly, we're hearing questions about WHO creating a contingency fund of sorts so that it could respond quicker and cover the cost of that response off the front end. The question here is how is WHO allocating resources more efficiently in emergency situations like Nepal? I think the situation you just mentioned in your region is really an example of how a contingency fund can work. Can you talk about how you use it?
Certainly. This fund was set up, as I said, as one of the aftermaths of the tsunami. It was set up in 2008, and the fund is, interestingly, a pool of the resources of the member states. It's not a fund that WHO puts up with its own resources. So 1% of the AC budget of the member states is put into this fund. And so we have a fund.
And the AC is the assessed contributions,
That's right.
what they have to pay in. Yes. Okay.
So it's AC we use, 1% of it, because it's more reliable. We know it's coming, it's there. And then this, we put in our regional share also. It comes to about $1 million for a biennium. We have a cap on this fund. We worked on business rules for the fund, and we have a cap of $350,000 on one emergency. But we don't release the entire amount in one go. Yeah. We split it into 2. The first installment is $175,000, which we gave to Nepal immediately. And under this fund, just on an email from the Ministry of Health to the WR, after they declare a state of emergency, the fund can be released by me. So it comes to me, and within 24 hours, we release the fund. And that is what we did for Nepal.
So it really allows you to mount an immediate response.
Absolutely. I do feel this is what helps the most, because then they can use the fund where the needs are. So when they send a proposal for the fund, they need to very broadly identify the areas where the fund would go. We have it, we release it to them, they use it, and we take the account from them later. So that's the way it works, and it's worked very well in our region. Every country of ours, except 1 or 2, have taken advantage of this fund. And member states like it. We take it to the regional committee every year to show them the accounts. Every country has one representative on a committee we set up which monitors the fund. So countries are happy, and I feel that this is something which answers the immediate needs of the country.
It's a good model for what they're talking about now. A last question for you, just very briefly. The viewers on Twitter have asked what is currently happening following the earthquake in Nepal. If you can just take 30 seconds and talk about the response on the ground now.
You see, what happened was that normally a response stage lasts for 7 days. In Nepal, we had one earthquake following the other. We had one, which you mentioned, on the 25th of April, followed by one on the 12th of May. And just 2 days ago, there was another one of 5 on the Richter scale. But they have been having aftershocks regularly. So Nepal is in a situation where they're looking after the injured, as well as looking after those who need rehabilitation. There are lots of surgeries that have gone on, mostly related to orthopedics. And at the moment, I think the greatest need is mental health. There are psychosocial needs of people. As far as women go, the needs are there. There are women who are pregnant who need to deliver. There are women who are lactating. They need to be taken care of. So WHO has set up tents for them. We are working very closely with our partners, with UNICEF, on water and sanitation issues, because for WHO, the most important thing at the moment is to avoid outbreaks. So we are seeing that there is no disease outbreak. And for that, we need clean water to see that there are no waterborne diseases like diarrhea. And with the coming monsoons, we are worried about vector-borne diseases. So that's the way we are looking at our response.
Terrific. Dr. Poonam Singh, thank you so much for your time. She probably has not slept for a month. There is so much going on, but there you have it. WHO still on the ground, actively responding to the health needs after these earthquakes in Nepal. And earlier this week, you'll remember that we talked about the mental health guidance that was given just a few days after the first earthquake there, to try to help people provide assistance to those who were struggling after the earthquake. Now, every year, WHO celebrates something we call World Health Day. World Health Day is our birthday, and we use it to call attention to an important global health issue. And this year, it was food safety, because unsafe food contains bacteria, viruses, parasites, chemicals. It can cause up to 200 diseases. Many of them can be prevented with proper food production, handling, and cooking. Let's take a look.
In a remote village of South America, these women receive a training about WHO's campaign entitled 5 Keys to Safer Food. Everywhere in the world, people deserve the right to safe and nutritious food. Yet today, more than 200 diseases are caused by unsafe food containing harmful bacteria, parasites, viruses, or chemical substances. Everyone who grows, manufactures, transports, stores, sells and prepares food, or implements governmental regulations, needs to be educated and get involved. In April 2015, to draw attention on this global issue, WHO launched a campaign on food safety at the Rungis market in Paris, one of the largest international food markets in the world, in the presence of Dr. Margaret Chan, Director General of WHO.
In this Regis market, where I see the Ministry of Health, the health people, and the agriculture people working with the industry, the wholesalers, they are fully integrated to make sure that the quality of food that they are, distributing to different markets, is safe. Choice is important, but quality is equally important. And every individual can contribute to food safety. It is everybody's business, from the farm where they produce, where food are distributed, as in the case of the wholesaler, and to your home. You prepare food at home, you eat food at the restaurants. So along the entire food supply chain, every individual can make a contribution to make food safe. Safe food is good for the country's economy, it's important for trade, And it's important for tourism, and this is important for the country's reputation as well.
Now joining me now to talk about food safety is Dr. Kazuaki Miyagishima. He is our Director of Food Safety at WHO. Kazuaki, talk to me about this. I think food safety issues are far more prevalent than many people realize. What kinds of diseases are we talking about with food safety?
Well, many people can easily imagine diarrheal diseases because it is even easier to establish the link between the symptom and the food you eat or the wrong food you ate. But in terms of long-term effects of food safety, we have a range of chemicals that may cause cancer, that may cause other handicaps to human beings. So in that cases, the causal relationship between the agent and the effect is not so clear to the victims of the situation. So this is the reason why we need to cover the whole range of foodborne hazards.
So where do the problems come in? When you're looking at how food is grown, how it's shipped, how it's cooked, how it's served, where do the problems that cause food safety come?
Well, the problems may come from any point. That is the tricky part. Let me explain. Today, some people may eat food that they grow themselves or they catch themselves. But this is only a small fraction of the world population. The huge majority of the people eat food that is produced by somebody else and transported hundreds or thousands of kilometers to the place of consumption. So this is a reason why we face a big challenge, because conversely, you may eat the food which is produced by somebody who you don't know. Or you are producing food and you don't know who is going to eat the food you produce.
So you don't know how it's been handled and whether or not it's been handled in a safe way or cooked in a safe way. To what degree is globalization of our food supply making the problem worse?
Well, globalization may make the problem worse or even better.
Okay.
It depends. Thanks to the globalization, the population in the world can benefit from a bigger and better variety of foods at affordable prices. And that is a benefit of trade we need to recognize. But however, if the food is traveling thousands of kilometers and through the hands of different food operators, if something goes wrong, it is very hard to track down. And by the time you find the reason at the point of contamination, the food may be already shipped to thousands and hundreds of different countries, and even most of them consumed. And this put the enormous challenge on us. And now the information exchange has become a big key. The time is over where the foods are grown in one country and consumed in the same country. Now we have to put in place a system to exchange emergency information between countries.
So what is WHO doing to improve the safety of food supply around the world?
Well, we have a range of different activities. Let me quickly start with standardization. Because foods travel across the borders, it's not good enough to have one country own standards to regulate foods. I think we need a common international standards and the safety standards for major commodities that are traded. And we established 50 years ago within the UN system the Codex Alimentarius Commission to develop food standards and agree on internationally on the common standards. But we need a scientific basis. We need good toxicology, we need good epidemiology to advise this food standard setting process. So WHO provides scientific advice to this process. And we need to revisit the same chemical, the same compounds repeatedly as and when new evidence becomes clear. And also WHO's one important program is to help countries to put in place decent food safety regulatory mechanism. It may be legislation, it may be laboratory, it may be training. There are many, many fronts we need to work. And finally, we want to facilitate information exchange between member countries to better manage food emergencies.
All right, so let's take it down into the home for just a moment. One last question for you, very briefly. What is the most important thing that people can do to keep their food supply safe? What would you say?
Well, what I would say is to observe good practice, good food handling practices, which everybody can respect. Our flagship product for health education is 5 keys
Show it to that camera over
to
there,
safer food. 5 keys to safer food, and this guidance is translated in more than 70 languages and used in more than 100 countries to train restaurant staff, street food vendors, the staff working in school canteens, home and women's group. And this is very simple 5 keys to observe, and then you can eliminate a lot of risks from what you eat.
What are some of those 5 keys?
The first is that to use safe food and safe ingredients. Second, you have to keep your hands and cooking environment clean. Third, you have to separate cooked and raw materials. And then you have to apply, for instance, to cook 70 degrees Celsius to eliminate harmful bacteria. And after cooking is over, keep your food at safe temperatures.
There you go, straight from our food safety team. 5 things you can do to prevent foodborne illness and stay healthy while you enjoy your food. Kazuaki, thank you so much for joining us. All right, appreciate it. Now, yesterday we were talking with some youth advocates who were working with their communities to try to make a difference on some public health issues. And we got to talking about how individual people, small organizations really can make a difference in public health. Well, yesterday evening at the World Health Assembly, some awards were given out to people who are doing just these. There were 4 awards. It was the annual awards ceremony, and there were 4 prestigious prizes given out to people who've really made a difference in public health in their community. Joining me now to talk about those awards and what the organizations and the people were doing in order to receive them is Paula Piazza from our governing bodies team. She's been overseeing the organizing of these awards for about the past 8 years now, yes. I think. Doesn't it sound right?
Yeah.
Tell me a little bit about the awards. What are they and who were they given to yesterday?
Well, the awards, we have about 10 that are kept in WHO, let's say run by WHO on behalf of foundations. They've been created in name of, in memory of, or by some public health, eminent health public people. And they're usually for outstanding achievements in general health development. And this year we gave 4. And health promotion, public health, family health. And as from next year, we'll be recognizing also healthcare for the elderly, which is a very exciting area that we're going into. So the 4 prizes that were given this year, we had the Sasakawa Prize. That was given to a foundation from Poland called Childbirth with Dignity. It's a very, very interesting group of people who decided to give women their own, to help them have a better experience when giving birth. For example, they would no longer be separated from their babies once the baby was born, and their partners could actually be with them. And they were empowered to demand to be treated with more dignity, let's call it that.
Real change
real
in that
change.
community, yes, absolutely.
Yeah.
Who else got awards yesterday?
So the other one was the United Arab Emirates Foundation, who gave to a Polish foundation called Akogo. And the Akogo looks after children that are in a coma. And as you might imagine, this can be a very, very expensive and lengthy experience for families. Not all of them can afford it. Practically nobody, in fact, can afford it. Plus, just knowing how to look after these children. And so this, again, a group of people decided to create this foundation, led by a famous actress of Poland. And so they, in the meantime, they've looked after, I believe, at least 25, 30 children, and 19 have woken up. So they help these children for at least a year in their own facilities, and then if they still need special care, they can be sent home because the families in the meantime have received training.
Nice.
And so there's a whole set of help that's being offered to the families, to the child, of course. And again, to speak to these people and realize the impact that they're having on these families is incredible. Indeed. And it's very energizing.
Number 3?
Number 3. Sorry, I'm talking too much. I get so enthusiastic about these prizes.
This is what it's all about.
Yeah. And the Kuwaiti prize, the State of Kuwait prize was given to Dr. El Garawi. And that is for establishing his own personal desire to establish the national program for rheumatic heart disorders. He was operating, doing heart operations, and he realized the impact of this condition on the incidence of heart operations. And so he decided that by establishing this program he could perhaps reduce, and effectively there is proof. It's been measured. Yes, he did have that impact. And so that was very exciting. And finally, the J.W. Lee Prize. And this one went to the Thalassemia Foundation, the International Thalassemia Foundation, which is based in Cyprus. And this is an interesting foundation where they have now over 170, let's say, national groups that have been created around the world and that are, let's say, in relationship with this. And this is similar to a blood sickle form of...
like a sickle cell anemia.
Yes, yes, similar to that. And again, who's heard of thalassemia? Not many people.
Yeah.
And this...
People giving for what the community needs.
Yes.
Now talk about 2 things for me. Number 1, why are these awards so important? And if somebody wants to apply for one of them in the future, how do they do it?
They're so important because they remind WHO, they remind all the people who are, for example, attending the assembly, of the grassroots impacts of an individual, of a group of people who have taken on them to try and help, to try and make a difference, let's say. And, sorry. And it also shows the way that the work that WHO is doing can translate down to grassroots level, but also the impact that grassroots level can have on the decisions that we're taking. So it's
that's what I was thinking of too. It goes both ways,
yes,
doesn't it?
It does, definitely. And that also is why having the award ceremony during the assembly is so important, because it can just show to people who spend hours in our meetings, hours preparing for them, all the member states coming here from far away and just reminding them that, those are the individuals that we are working for.
This is really what it's all about, right?
Yes, yes.
All right, so if somebody wants to apply in the future, how do they do that?
Well, they can go to our website and they can contact us. And we send out a call for nominations to the authorities, to the health authorities. And they should be applying through them, but with pleasure we'll help them to get in contact with the health authorities and to get these applications.
Okay.
Thank you.
Thank you
very
so
much for having
me. Appreciate
me.
it. Thank you for coming by.
It's a pleasure.
So there you go, getting to see public health and improving health in a community at the grassroots level, making a difference here at the World Health Assembly. If you're interested in one of those awards, or if you know an organization or a person who you think would be a good candidate for it, check in with your local health authorities or our website to see what the timeline is for signing up for those. Now, all week long we've been talking about work at the World Health Assembly here in Geneva. WHO works at global level, regional level, and country level. So what happens after this week is over? How does what was achieved here this week translate to improving your health in your community? Joining me now to talk about that is somebody that has been at every level, country level, regional level, and global level. Dr. Carissa Etienne, who is our regional director for the Americas. She's worked at national level. She's worked here in Geneva, and now she runs the region. Carissa, thanks for joining us. How do we move forward from here? We've been following a lot of progress here this week. Once the World Health Assembly ends next Tuesday, how does it go forward to make a difference at regional and national level?
Thank you, Christy. I'd like to say the real work begins after the assembly, because we need to go to the regional level to ensure that our technical cooperation meets the needs of member states. But importantly, we need to work with member states to ensure that they can meet the targets and the objectives that have been set.
Okay.
So for instance, let's take the malaria resolution was passed, and member states decided that they wanted to eliminate malaria from 35 countries. So we need to go back and see what does that mean for the region. We need to define a plan of action for 2016-2019. Our last plan of action will end this year. But we need to focus now on which countries we are going to eliminate malaria from. And we've already decided that in Central America and Dominican Republic and Haiti, we will move to eliminate malaria. And importantly, we have 21 endemic countries, and we have to decide now how are we going to ensure that by 2015, the end of 2015, we will have a 75% reduction in incidence. Now, this is not easy, but we know that we can achieve it. As you know, the American region is a region of achievements, no? We are the region that does everything first, no? So we will be happy. So going back next week, in June, we have executive committee. We will begin to look at some of those targets and how we are organizing to do this. But more importantly, we'll then go to country level. We need to work with our member states to ensure that everyone who has malaria is diagnosed and treated, but more importantly, that we prevent it. And so the political commitment and the political will is important. And because many of our ministers have been here, and because they too are really very committed to achieving universal health coverage and universal access to health, they want to themselves eliminate malaria and to reduce the incidence. So the political will is going to be important. We need to make sure that we strengthen our health systems to do that. Integrated vector control, we need to get rid of the mosquitoes, no? And we have to prevent the mosquitoes from biting the people so they get infected. And importantly as well, to ensure that we have treatment. Important that malaria is within the list of priority programs and that we have access to the prevention, to the care and to the treatment that they need in a cost that people can afford, no? Okay. And doesn't impoverish them.
Does anything that happens here in Geneva ever get adapted at all for nuances of a region?
Always in our region, yes. See, our region, we like to say, has made many achievements. So, for instance, polio. We don't have polio eradication as one of our objectives. We have maintaining and sustaining the elimination of polio. So we do adapt many of the resolutions and the plans of actions for the specificities of the region.
So you get that kind of flexibility?
Yes, we do.
Okay.
Yes.
All right, so talk about what happens at country level now. So you go back to the region, you make a strategy. At country level, go back to your chief medical officer days. Okay. What happens when you're watching this from a country?
So, and I will take an example. So let's say the global vaccine plan was passed, no? And the region will pass its regional plan. So I need to go to country level as a chief medical officer and say, okay, there are a number of new vaccines that I need to include on my vaccination schedule. Can my government afford it? So I will seek PAHO's help to help us to make the investment case to see whether the country can afford it and whether the country will include it in its budget. And so I will be assured of the money to purchase the vaccines. I then have to look at our national vaccine plan and make sure that I include some of those vaccines, but also that I expand the coverage where necessary to meet the targets that have been set. No? And then I must build the capacity of the healthcare workers, particularly if there are new vaccines. I have to make sure that the infrastructure from vaccines, that there are fridges and that the cold chain is being kept, else the vaccines are not worth it and will not immunize. And then I have to ensure good surveillance and I have to ensure good reporting. And this, as a chief medical officer, I have done with extremely good success, which is the story for all of Latin America and the Caribbean. You will know, and this is a little time for advertisement, but you will know that we are the first region that has eliminated polio, eliminated rubella and congenital rubella syndrome.
Yes, that's
and
huge.
Just last week.
Congratulations, by the way.
And next year it will be measles.
Yeah, that's wonderful, wonderful. Carissa, thanks for coming by. So, in essence, the people, the chief medical officers at country level are watching what's happening here at the World Health Assembly this week?
Yes, and some of them are here actually. So some of them travel with their ministers because they are to give technical advice to the ministers in terms of how do they want to change the resolutions, what are some of the issues that need to put into the plan of action. So some of them are here as well. And that also helps build the commitment to ensure the implementation at country level.
Super. Dr. Carissa Etienne, thank you so much, and congratulations on that progress that you've made in the Americas region. It really is quite huge. So there you go. This is going to conclude our coverage, actually, for World Health plus Social Good at the World Health Assembly here in Geneva. I hope you found it useful in connecting into ways that we are trying to improve public health at all levels. Many of these things need to move forward together. Over the past 5 days, you've had the opportunity to connect into 35 of some of the top health experts in the world, and nearly 10,000 of you did that. Now, the work will continue here over the weekend and into the early part of next week. If you want to keep up with what is happening, then you can follow us on Twitter and you can follow the web stream. For now, I'm Christy Feig from all of us here at WHO and the UN Foundation. Thank you for joining us.